There is a word that can freeze a room in seconds, a word that can turn an ordinary afternoon into a dividing line between before and after, a word that people whisper as if saying it too loudly might make it more real, and that word is cancer. It does not knock politely, and it does not care about your plans, your age, your fitness level, or how carefully you think you have lived your life. It has a way of entering conversations in the quietest moments, during routine checkups, casual appointments, or unexpected phone calls that begin with, "We need to talk." 1 minute, you are thinking about deadlines, family dinners, future vacations. The next, your mind is spiraling into a place you never imagined you would have to visit. Cancer carries with it a weight unlike almost any other diagnosis because it represents uncertainty in its purest form. It represents questions without immediate answers, nights without sleep, and a fear that settles deep in the chest and refuses to loosen its grip. And what makes it even more terrifying is that for many people, it doesn't begin with drama or obvious warning. It can begin in silence, growing quietly while life continues as normal. You may feel fine, you may look fine, you may tell yourself that everything is probably okay, but somewhere inside, a small voice might wonder, what if? That question alone is powerful enough to change the way you see every sensation, every ache, every moment of fatigue. Cancer has touched nearly every family in some way, through a parent, a sibling, a friend, a colleague, and you have likely seen the emotional toll it can take, the way it transforms strong, vibrant people into fighters facing battles they never signed up for. You have seen the hospital corridors, the tense waiting rooms, the hopeful smiles that try to mask deep fear. And perhaps, if you are honest with yourself, there have been moments when you've wondered whether it could ever happen to you. That quiet thought you push away, that uncomfortable curiosity you dismiss. The truth is, cancer does not discriminate. It does not check your calendar to see if now is a convenient time. It does not measure how much you still want to accomplish. It simply exists as one of the most serious health threats in our world today, a condition that commands attention the moment it is spoken. And the scariest part, many people never imagine it applying to them until it does. This is why the conversation matters. This is why awareness matters, because ignoring the possibility does not make it disappear. If you have ever felt a flicker of concern, if you have ever paused for just a second and thought, could this affect me? Then you owe it to yourself to stay here, to listen closely, and to confront the fear with knowledge instead of silence. When we talk about what this disease really is, it helps to step back and understand it in the simplest and most human way possible, because at its core, it is not just a medical term. It is a change that begins deep inside the body, often long before anyone realizes something is happening. Our bodies are made up of billions of tiny cells that are constantly growing, dividing, and replacing themselves in a very organized and controlled manner. This process usually works perfectly, like a system that knows exactly when to start and when to stop. But with cancer, something in that system begins to go wrong. Instead of following the normal rules, some cells begin to grow in an uncontrolled and unusual way. They don't stop when they should, and they don't behave like healthy cells anymore. Over time, these abnormal cells can gather and form masses or sometimes spread quietly within the body, affecting how normal organs and tissues work. What makes this disease especially frightening is not just the word itself, but the way it can exist silently for a long time, blending into everyday life while a person feels completely normal on the outside. Many people imagine disease as something that shows up suddenly, loudly, and clearly, but cancer can be different. It can be a slow, quiet process that develops over time, making it harder to notice in the early stages. That's why understanding what it is, at a basic level, is so important. It is not one single illness with one simple story. It is a condition where the body's own cells begin to lose control, and that loss of control can affect different parts of the body in different ways. Some people think of it as something that only happens to others, to someone older, or to someone with a different lifestyle, but the truth is, it is a human disease that can touch any family, any community, any life. When people first hear about it, they often feel a wave of fear because it sounds complex and overwhelming, but understanding it calmly can remove some of that fear. It is a medical condition, yes, but it is also a journey that many people go through, one that involves emotions, questions, strength, and support. It changes the way a person looks at their body and their health. It makes them more aware, more careful, and sometimes more anxious. Yet, it also reminds us how important it is to listen to our bodies and take our health seriously. Think of it as a situation where the body's natural balance slowly shifts, and that shift can begin without pain, without noise, without clear signs in the beginning. That is why awareness matters so much. Not to create panic, but to create understanding. When you know what a disease truly is, you are not as helpless in front of it. You begin to see it not just as a scary word, but as something real that can be faced with knowledge, care, and attention. And if hearing this makes you pause for a moment and reflect on your own health, that's not a bad thing. It simply means you are becoming more aware, and awareness is always the first gentle step toward protecting yourself and the people you love. When we begin to talk about what leads to this disease, it's important to understand that there is rarely just one single reason, and that can make it feel confusing and even frustrating. Many people want a clear answer, something simple like one habit or one mistake that caused everything, but in reality, it usually develops because of a combination of different factors over time. Inside the body, cells are constantly dividing and renewing themselves, and sometimes small changes can happen in the way these cells grow and behave. These changes may build up slowly over years, quietly, without any immediate effect, and that is why many people never connect their daily lives to what is happening deep inside. Age can play a role because as time passes, the body goes through countless cycles of growth and repair, and with each cycle, there is a chance for small errors to occur. Family history can also matter. Some people may carry certain traits that make them more likely to face this disease, even if they live a healthy life. This does not mean it is guaranteed, but it does mean the body may be more sensitive to certain changes. At the same time, lifestyle can influence how the body responds to stress, food, environment, and daily habits. Long-term exposure to harmful substances, such as polluted air, tobacco smoke, or certain chemicals, can slowly affect the body's natural balance. Even the sunlight we enjoy can, over many years and without protection, cause changes in the skin. It's not about blaming yourself or thinking that every small choice leads to something serious, but more about understanding that the body keeps a record of what it experiences. Diet, physical activity, and overall health also shape how strong the body's defenses remain over time. A body that is constantly tired, stressed, or not getting proper care may find it harder to repair itself as effectively as it should, but it's also important to remember something comforting here. Many people who live very healthy lives still face this disease, and many who don't follow perfect routines never do. This shows that causes are often complex and not always fully in our control. Sometimes, changes happen inside cells, without any clear reason at all. It can be a natural part of aging or simply something that develops over time without warning. Emotional stress, lack of sleep, and constant pressure may not directly create the disease, but they can affect how the body functions overall. And when the body is under strain for long periods, it may become less balanced. So instead of thinking about causes as something to fear, it may help to think of them as pieces of a puzzle. Some pieces we can influence, like the way we live and take care of ourselves, and some pieces are simply part of life and time. Understanding this helps remove guilt and replaces it with awareness. And awareness is not meant to scare you, but to gently remind you that your health deserves attention, patience, and care. Listening to your body, respecting its needs, and taking small steps to protect it can make a real difference. And if this conversation encourages you to be more mindful and more connected to your well-being, then it has already begun to serve its purpose. When we talk about symptoms, it's important to understand that they can be very subtle at first, almost like whispers from your body that something isn't quite right, and often people overlook them because they feel normal or temporary. Unlike an injury that causes immediate pain, this disease can start quietly, with changes so small that they are easy to dismiss. You might notice unusual fatigue, a general sense of being more tired than usual, or persistent discomfort that doesn't go away even after rest. Sometimes it shows up as unexplained weight loss, a loss of appetite, or feeling weaker in ways that don't make sense with your daily routine. Skin changes, such as new lumps, bumps, or discolorations, may appear, and they can feel frightening, but it is important to stay calm and observe them carefully. Some people notice digestive problems, persistent coughs, or unusual bruising or bleeding that seems to happen without reason. The challenge with this disease is that these signs are not always dramatic or immediately alarming, which is why they are often ignored or attributed to stress, poor sleep, or simple fatigue. But even small changes are your body's way of signaling that something may be happening beneath the surface. Emotional and mental shifts can also accompany the early physical signs. People often describe feeling more anxious or unsettled, with a sense that their body isn't working as it should, even when tests haven't shown anything yet. These subtle changes are important to acknowledge because they give you the chance to act early. The patterns of symptoms can vary greatly from person to person, depending on where the disease begins and how quickly it develops. For some, there may be noticeable swelling, pain, or persistent soreness in certain areas, while others may feel a general sense of malaise that comes and goes. One of the hardest parts about recognizing symptoms is that life continues as usual around you. Daily tasks, work, and family responsibilities can distract from what your body is trying to communicate. That is why it is essential to listen carefully and not ignore persistent or unusual changes, even if they seem minor. Early recognition can be powerful because it allows you to take steps to understand what is happening, to seek medical evaluation, and to address the problem before it progresses further. The key is not to panic, but to pay attention, to track what you notice, and to communicate openly with your healthcare provider. By doing so, you are giving yourself a chance to face the situation with knowledge rather than fear, with preparation rather than uncertainty. And if you take away one thing from understanding symptoms, it is this: your body is always sending signals, and listening to those signals with care, patience, and attention can make a difference. Remember that noticing small changes early is not a reason for despair, but an opportunity for awareness and proactive care. And by paying attention to yourself today, you are taking the first gentle step toward protecting your health and the life you cherish. When we talk about prevention, it's important to understand that while we cannot control every factor, there are steps we can take to give our bodies the best possible chance to stay healthy and to reduce the risks of serious disease. Prevention is not about fear or rigid rules. It's about awareness, mindfulness, and creating habits that support your body every day. It begins with paying attention to your lifestyle choices, because the small decisions you make consistently over months and years can have a meaningful impact on your overall health. Eating a balanced diet, rich in vegetables, fruits, whole grains, and lean proteins, helps the body stay strong and maintain its natural defenses, while limiting highly processed foods, sugary drinks, and excessive fats can reduce unnecessary strain on organs and cells. Physical activity is equally important. Regular movement, whether it's walking, stretching, cycling, or any form of exercise you enjoy, keeps the body active, helps regulate hormones, and supports healthy circulation, all of which can make a difference in how well your body repairs itself over time. Avoiding harmful habits is another key part of prevention. Smoking, excessive alcohol consumption, and repeated exposure to environmental toxins can accelerate cellular damage and make it easier for problems to develop unnoticed. Staying mindful of these risks is not about creating anxiety, but about giving yourself the awareness and power to make choices that protect your health. Routine checkups and medical screenings are also essential. Even when you feel healthy, visiting your doctor for regular evaluations, blood tests, imaging, or age-appropriate screenings can help detect changes before they become serious. Early detection is one of the most effective tools in prevention because it allows intervention before problems progress. Mental and emotional health play a surprisingly significant role as well. Chronic stress, lack of sleep, and emotional burnout can affect hormone balance, immune function, and overall resilience. Prioritizing rest, practicing mindfulness, seeking support when needed, and creating a life that balances work, relationships, and self-care strengthens the body's ability to maintain stability over time. Vaccinations and protective measures are another way to actively reduce risk. In some cases, vaccines and preventive medications can help guard against infections that might otherwise increase susceptibility to serious disease later. Prevention is not about perfection. It's about building patterns of care that you can sustain and feel good about. Choices that gradually tip the balance in favor of health rather than worry. It's about taking small, consistent steps, like choosing a healthy meal, scheduling a checkup, or going for a walk, that accumulate over months and years to create a real protective effect. The message here is gentle but clear. Prevention gives you agency. It reminds you that while not everything is within our control, the decisions we make every day do matter. And by paying attention, by caring for your body, your mind, and your habits, you are not just preventing disease. You are nurturing a life of strength, awareness, and resilience. Every small step you take today is a gesture of care for your future self, and embracing these habits is the quiet, powerful way to protect your health and the life you value most. When we talk about treatment, it is important to understand that this is not a single approach or a quick fix, but rather a journey that is carefully tailored to each individual because every person's experience with this disease is unique. Treatment begins with a clear understanding of the type, stage, and location of the disease, which guides doctors in choosing the safest and most effective options. Some people may require surgery, where doctors work to remove abnormal growths in a way that preserves as much healthy tissue as possible, while others may benefit from therapies that target cells more broadly, such as radiation or specialized medications that interfere with the growth and spread of disease. Modern medicine has made incredible strides, offering treatments that are more precise, more effective, and often less invasive than ever before, but they still require patience, planning, and careful monitoring. Medications, including chemotherapy, immunotherapy, and targeted therapies, work in different ways, some by attacking abnormal cells directly, others by helping the body's own defenses recognize and fight the problem more efficiently. Each option comes with its own set of considerations, possible side effects, and timelines, which can feel overwhelming at first, but knowing that every choice is guided by evidence, by research, and by a team of professionals can bring comfort. Supportive care is just as important as the main treatments. Managing side effects, maintaining nutrition, staying active within safe limits, and nurturing emotional and mental well-being all play a critical role in helping the body respond to treatment effectively. Patients often find that having a network of support, family, friends, medical staff, counselors, and patient communities makes the journey more manageable and helps maintain hope and resilience even on difficult days. Communication with your healthcare team is key. Asking questions, expressing concerns, and understanding the reasoning behind each decision empowers you and creates a partnership in your care. Treatment may take weeks or months, sometimes longer, and it often involves adjustments along the way because the body responds differently over time. This is normal and expected, and it is not a sign of failure, but rather an opportunity to refine the approach for the best possible outcome. Emotional strength and self-care are deeply intertwined with the medical process. Many people discover reserves of courage and determination they didn't know they had, and the process itself can be transformative, teaching patience, gratitude, and awareness of one's own resilience. The most important message about treatment is that it is never something you face alone. There is a team, a plan, and strategies in place to guide you through each step, and every effort is focused on helping you live as fully and as comfortably as possible. If you take anything from this, let it be this. Seeking treatment is an act of courage, a conscious choice to fight for your health, and each decision, each appointment, each step forward is a sign that you are not just surviving, but actively protecting and honoring the life you have. Remember that even in the hardest moments, there is hope, there is care, and there is support surrounding you, and by embracing treatment with knowledge and trust, you are giving yourself the best chance to move forward with strength and dignity. As we reach the end of this conversation, I want you to take a moment and simply breathe, because understanding this disease, hearing its story, and learning what to look for can feel heavy, even overwhelming, and it's okay to feel that. What matters most is that knowledge is power, and by listening, by paying attention to your body, and by taking even the smallest steps toward awareness, you are giving yourself a gift that cannot be taken away. Life is fragile, yes, but it is also precious, and every action you take to care for yourself, to notice changes early, and to reach out for help when you need it, is a testament to your courage and your love for the life you are living. There is no need to feel guilt, no need to feel panic, just a gentle reminder that awareness, mindfulness, and proactive care are your allies. Remember that this journey is not something anyone has to walk alone. Doctors, nurses, loved ones, and even communities exist to support, to guide, and to share strength when the road feels uncertain. Take comfort in knowing that the small steps you take today, checking in with your body, scheduling a routine exam, listening to what feels unusual, can have a profound impact on your health tomorrow. Your body is always communicating with you in quiet ways that you may not notice until you slow down and listen, and by doing so, you honor yourself in a deeply meaningful way. Let this moment serve as a reminder that life is delicate yet resilient, and that your attention, your care, and your willingness to act make all the difference. Even in the face of fear or uncertainty, hope exists, and hope is strengthened by knowledge, by preparation, and by the courage to face what is real. Take what you have learned here, carry it with you gently, and let it guide the choices you make, not in fear, but in care, in awareness, and in love for yourself and those who matter most. Every day is an opportunity to honor your health, to listen, and to take steps toward a future where you are informed, empowered, and strong. And as you move forward from this conversation, know that you are not alone, and that each mindful action you take is a quiet yet powerful way of protecting the life you value so deeply.